Healthcare Staph aureus bloodstream infections are reportable and associated with significant morbidity and mortality. The SAB rate in Australia is approximately 20%, and peripheral cannulas account for almost a quarter of all healthcare associated SABs. Around 30% of the human population is colonised with Staph aureus, and it's also one of the leading causes of bacteremias and device-related infections. The antecubital fossa has more Staphylococcus species than any other area of the upper and lower arm. These infections are usually preventable and incur a significant healthcare cost, and they're often associated with poor hand hygiene practices, suboptimal insertion or management of IV devices. This study was conducted in light of the rise of our institution's healthcare associated SAB rate. In the third quarter of 2019, our SAB rate was 1.62 per 10,000 occupied bed days, compared to 0.60 in the first quarter of 2019. 33% of these BSIs were attributed to cannulas. Along with that, our institutional surveillance also highlighted there was a growing trend in the increased placement of cannulas in the antecubital fossa at a rate of 60%. The primary objective of the study is to implement an educational program to enhance awareness and reduce the overall prevalence of antecubital fossa cannulas, and also the secondary objective is to reduce the overall rate of our healthcare associated SABs. Our methodology: there was a baseline digital survey to identify a root cause for clinical decision making related to ACF cannulation, a widespread education with significant focus on our emergency department where a large proportion of cannulas are inserted, clinical change champions in our emergency department, senior medical officers and senior medical nursing staff to drive the initiative. There were weekly audits and feedback, and there was also advertising and promotion. The survey: 581 staff completed our survey. It comprised of 8 questions that assessed the respondents' clinical role, their knowledge on dwell times of cannulas, and their understanding of the role of site selection when inserting a cannula. The rationale of the survey was to promote clinicians to think about the best anatomical place for the cannula based on the patient's status, medication or treatment plan prior to cannulation. Over the 12-week intervention period, there was a steady decline in the overall ACF rate. Week 1, there was a rate of 78% of all cannulas audited were placed in the ACF. The rate continued down, and week 9, only 33% were placed in the ACF. Near the end of the intervention period, there was definitely a spike in week 11 and 12. Coincidentally, the health service had a new rotation enter of new doctors and interns, and this may have been a contributing factor. There were no healthcare associated SABs during the 12-week period. And in conclusion, engaging clinical champions to lead change using patient outcomes data like the SAB rate, assist healthcare staff to embrace the change and to really think about anatomical site selection prior to cannulation. Thank you.